Hello, I'm John Foster, and I'm a medical doctor who does Social Security disability exams. And today I'm going to talk about a topic that I find fascinating, namely malingering. As usual, everything I say is based on my own experience and study and does not reflect the opinions of the Social Security Administration or any other medical body. Now, sometimes malingering is overdiagnosed in compensation patients. It's important to understand that not every patient who displays functional signs, non-physical, non-organic signs, or functional complaints is a malingerer. In fact, I find that malingerers are a minority of the patients who display functional signs. More common are 1. Hypochondriacs, people who are high in neuroticism and believe that they are ill when in reality they are not. And number 2, symptom exaggerators, people who actually have a physical disease or injury, seek compensation, and decide to exaggerate somewhat on the exam in hopes that that will guarantee their application for compensation will be approved. The true malingerer is consciously lying. They know that they are not ill or injured, and they have decided to pretend to be ill or injured in order to fool the physician and the compensation body into granting them compensation. Malingerers can be seeking many things, including money, drugs, sex, or power, but in the setting of disability exams, they're seeking money. There's surprisingly little in the medical literature about malingering, and most of what there is in the psychiatric literature, very little in the physical realm. In fact, some authors state that there's no such thing as malingering, which I think is dead wrong. I think some physicians feel guilty when they label a patient a liar. After all, we're taught to do everything possible to help our patients, and calling a patient a liar and denying them access to something they want certainly isn't helping them. I think it's important to remember that in Social Security disability exams, you are not examining the patient to treat them. The Social Security Administration is your real patient in that case. You are examining the patient in order to benefit the Social Security Administration. Now, just like everything in medicine, the prevalence of a condition will reflect the patient population seen. A geriatrician, for example, isn't going to see many 1-year-olds, and a pediatrician, for example, is not going to see many 90-year-olds. There are situations where malingering is common, and those include prison medicine and compensation medicine. That can be compensation for Social Security, other disability programs, compensation for automobile accidents, or workmen's compensation. Doctors practicing in medical legal fields are guaranteed to see a significant number of malingerers. Now, what's the psychology of a malingerer? Well, it's important to understand this is a person to whom lying to get what they want is acceptable, and denying others who are worse off than themselves money because they want it is acceptable as well. As such, these people are high in psychopathy, and the characteristics of psychopaths: first of all, they are abnormally low in neuroticism. Psychopaths do not get anxious in circumstances that would precipitate severe anxiety in a normal person. Likewise, they do not get depressed. They're also low in agreeableness and high in narcissism. The psychopath feels entitled to whatever they want, and they have no qualms about taking it from others. They also feel superior to others. They look at others as dupes or chumps. And when people believe their lies to the psychopath, that confirms their superiority and the inferiority of people that they've lied to. They feel that because you believed my lies, you deserve what you get from me. Because psychopaths are low in agreeableness, they lack empathy and caring. For example, a psychopath may be sitting in the waiting room where there's another patient waiting to be seen who's obviously crippled. The psychopath is fine with appropriating the money that should go to the person who's crippled for themselves when really there's nothing physically wrong with them. Now, I'm going to wander into dangerous territory here, but there are some definite psychological differences between men and women. On the average, women are more agreeable than men and also higher in neuroticism than men. Therefore, psychopathic personality disorder is far more common in men than women, and this is reflected in the relative preponderance of males incarcerated versus females incarcerated. That's not to say that there are no psychopathic women or no female malingerers. I've certainly seen female malingerers, but you can expect to see far more male malingerers than female. So what are some of the clues that a patient is malingering? Well, first off, they tend to be flashy. They tend to dress to impress. And they're the sort of person who'd wear a fake Rolex watch. They're not wearing the watch because they appreciate a piece of fine Swiss machinery. They're wearing it to impress other people, and they feel superior if the other person is duped into thinking that the watch is real. I always think of a man I saw for Social Security who came in wearing gold lame shoes, who was definitely malingering. Next, they tend to be glib and superficially charming. They may overpraise the doctor or act overly deferential. Conversely, they may offer subtle put-downs to make the doctor feel inferior, such as saying, "Oh, I thought I was going to see a specialist. You're a family doctor?" Their innate narcissism and sense of superiority leads to two problems. Number one, they don't tend to put in the work to discover what are the true signs and symptoms of the disease that they want to simulate. They often give fantastical, unrealistic complaints that have no relation to the true symptoms of the disease they claim to have. They may exhibit a phenomenon known as duping delight, which is lying even when there's no purpose or nothing to be gained by lying. They lie merely to feed their narcissism. If they can lie to you and you believe it, they've proven they're superior. The second downfall of the psychopathic malingerer comes in what I call the agility tests in the physical exam. These people always want to be superior. They want to be the best. So when asked to do things like do a tandem walk or a deep squat, even though they may have complaints that would preclude those activities, they tend to do them anyways, because if they couldn't do them, that would mean they were inferior, especially to the examiner who's demonstrating those movements. For example, I've seen more than one male malingerer complaining of severe knee pain, who, when I demonstrated a full squat and asked if he could attempt one, he squatted all the way down till his buttocks were touching his heels and then rose back up with no difficulty whatsoever. Absolutely impossible if the patient has real severe knee pain. The psychopath always wants to think that they're better than you, and they always want to show that they're better than you. So how to deal with these patients? Well, I've learned the long, hard way that the best thing to do is to say as little as possible. Don't argue with them. Don't tell them that what you're seeing doesn't fit with their complaints or to the disease that they claim to have. Just listen to their story, observe their behavior, and put down your findings in the chart. It's not your duty to correct or confront the malingerer. Well, I hope this has been helpful, and as usual, always remember, if it happens, it's possible.